Nurses from Sanford Fargo's stroke program performed a simulated evaluation as part of National Stroke Awareness Month. The goal? To educate patients and caregivers about the many different ways a stroke may present itself.
In stroke, all symptoms or signs are sudden. The more that we know coming in and the earlier we know it, the faster we are able to respond and get our teams ready.
Stroke program educator Sue Johnson talked through the most common symptoms, while Holly Nissen, stroke program coordinator, demonstrated the abnormal behavior that one might see if someone is having a stroke. Possible signs of stroke can be remembered using the acronym Be Fast.
Balance, they can come in walking, very unsteady, and if you have them do the finger to nose, it can be very uncoordinated. So looking for uncoordinated movements. Patients can also have a sudden onset of falling episodes. Eyes, double vision or blurry vision can happen. Other types of strokes, you can have a visual field cut, meaning you can't see to one side or the other. Face, we have people smile and we say show the teeth, so we can get a better assessment of if they have any facial weakness or not. Arms, we have them hold up their arms in front of them, and it could be just a slight weakness or they could be totally paralyzed on that side and the arm just drops. Speech, there's two parts of speech. We're looking at how clear somebody speaks.
It's a lonely day in Fargo.
And also if they're able to even get the words out.
Oh.
They may not be able to say anything. The other part of speech is understanding. Sometimes with stroke, people aren't able to understand the commands and they will look at you like you're speaking a foreign language. Terrible headache, there's a very specific type of hemorrhagic stroke where a blood vessel ruptures in the head. When that happens, they have a very sudden onset of a horrible headache. And most often when they come into the emergency room, they say, it's the worst headache of my life.
The T in Be Fast can also stand for time. The faster a stroke is treated, the better chance a patient has of surviving and of retaining motor function as well.
Anytime you notice any signs and symptoms of stroke, it's really important that you call 911 because that helps us to activate our system in the hospital. So as you're coming in, we're getting information from EMS, things like your blood pressure, your blood sugar, and that can help us to prepare our team to diagnose and better treat your stroke.
According to the Centers for Disease Control and Prevention, nearly 800,000 people have a stroke each year. Stroke is the fifth leading cause of death, and it is the leading cause of serious long-term disability in the United States. In Fargo, Jason Anschutz, Sanford Health News.